Hi again. Let's talk about the maxillary branch of the trigeminal nerve. As this slide shows, there are several major branches of the trigeminal, of the maxillary branch that you need to remember, and we'll go through those in order. This is one of the larger branches, this and the mandibular branch, but we'll spend a little bit of time on the maxillary branch. But what I would like to encourage you to do is to read the text carefully. There is a section in there on an expanded section on the trigeminal nerve and the facial. So you were introduced to all 12 of them earlier in the chapter, and then at the end they focus on these two nerves, the trigeminal and the facial. So read it carefully. It's technical. There's a lot of information there. When you're reading the text, use these lectures as a filter for what to focus on in the chapter. There are topics in the chapter that are covered in more detail than I'm doing in this class, so you can skim through those. In particular, the authors describe the anatomical pathway of some of these nerves in detail. And those kinds of details I'm not focusing on. So the level and sort of the direction that I'm going in these lectures is what I would like you to pay attention to. But you have to read the book. You have to read the chapter. Kind of ties it together. So let's start out. We will go through the zygomatic nerve first. There are two divisions of it, the zygomaticofacial and the zygomaticotemporal. And we'll do the IO nerve, the infraorbital, and then we'll do the alveolar nerves. And remember, we are on the maxillary branch, so everything is pertaining to the maxillary teeth, not the inferior alveolar teeth. And then we'll deal with the palate. And there are several palatine nerves, the greater and lesser palatine, and then the nasopalatine. So it's a fair amount. So let's go ahead and get started. Hopefully we'll do it in a way that makes sense. So I'm just starting through the nerves in order, and the first one was the zygomatic nerve. So you should familiarize yourself with this figure. Note that, there is a trigeminal nerve. There's cranial nerve 5. And then we have the three branches, V1, V2, and V3. That should all look familiar, and we are dealing with V2, of course, the maxillary branch. So you remember that V2 exits the cranium. The trigeminal ganglion is in the cranium. It exits the cranium through the foramen rotundum and then passes into the pterygopalatine fossa, which is kind of in this region. And there's our pterygopalatine ganglion. So we're not talking about all that yet, but I'm trying to keep you oriented on sort of what we've already talked about, what we've reviewed, and what we're seeing again. So the way the maxillary branch basically works is that you have the IO nerve, this infraorbital nerve. So I'm jumping ahead just a little bit to kind of give you an overview. So here's the IO nerve, and it passes through. And we'll come back to this, so you don't have to really draw all this out. But this is just the infraorbital nerve. And the pattern is that these other, remember this is all sensory. None of this is motor right now. So the infraorbital nerve in yellow, the other nerves merge with it. So there's the ASA, the MSA, the PSA, the palatine nerves, and the nasopalatine. They all merge with the IO nerve, and that's the way that the text is written. Those all merge together, and then we have this maxillary branch. And then all of those cell bodies, remember, are in the trigeminal ganglion. And then the signals continue on to the nerve. So the first branch of this that we're looking at is the zygomatic nerve. Now the drawing is hard to interpret, just this figure, but we're going out onto the side of the face. We're going out onto the zygoma. So we're originating deep in the pterygopalatine fossa, and a branch of V2 goes off, and it goes basically into the zygoma, the zygomatic bone, and then it's going to branch. So let's take a look at the next slide. I think it shows it a little more clearly. So here again is some of what I just drew. So here is the maxillary branch through the foramen rotundum. Okay, we've done that. And here is the trigeminal ganglion. And there are the cell bodies that I drew, and the arrow is going on. Okay, good. So here is the zygomatic nerve. Oh, and this nerve, again, here is our infraorbital. And note the direction of the arrows that are just indicating sensory information going back to the brain. Also remember the dermatomes. I think you might want to go back at some point. I should have copied it over, but you might want to see or review the dermatomes, the facial dermatomes. Let's get rid of that. Put a smaller pen. Facial dermatomes, and I believe it's slide 35. And I believe your slides are numbered sequentially. So remember, this is coming from the face, the maxillary division. And if you look at those dermatomes, it helps make sense. So here's the zygomatic nerve. And here are the two branches. The zygomaticofacial, which is skin from this region of the face. And it enters through, let me get rid of that, that's kind of a mess. It's picking up fibers from the face and entering through tiny foramina, and this is a zygomaticofacial. And then the temporal regions, again this is skin, it's sensory, runs down to the zygomaticotemporal, and they merge, and then we have the zygomatic nerve. So the zygomatic nerve merges with the IO and forms part of V2. Okay? So that's our zygomatic nerve, two branches. Zygomaticofacial and zygomaticotemporal for those regions of the dermatome. So let's go to the next slide. Still looking at the zygomatic nerve. So these slides show a lot, and we can come back and keep looking at these same images when we're discussing different nerves. But right now, again, we're still with the zygomatic. So get yourself oriented. Do you see the foramen rotundum in this slide? Yeah, it's right there. And you note the three branches. You know, there's V1 and V2 and V3. Okay. And then note, here is the trigeminal nerve. So from this point on, we would call that the fifth cranial nerve. Distal to that are the three branches, and of course the ganglion. So for example, if we're tracing the pathway back through V1, we might trace it back through the to V1, to the trigeminal ganglion, to the trigeminal nerve. We'll practice that more later. But here again I highlighted these, the two branches that we just looked at in the other image, the zygomatico-temporal and the zygomatico-facial. So they're running through the zygomatic bone, and they're just supplying afferent or sensory fibers for those regions of the skin. So they are running back. Let me switch to green. So here are the two branches. Now let me go to yellow. There are the two branches, and they merge in that thinner branch, and that's the zygomatic nerve. And it merges with the IO all back in that, essentially in that pterygopalatine fossa region. Okay, so the zygomatic nerve. We'll look at this slide repeatedly for other nerves. So what do I have in the text on the slide? We're talking about the zygomatic nerve. Remember that it carries postganglionic parasympathetic fibers from cranial nerve 7 to the lacrimal gland. Okay, let's discuss that just a little bit more. I keep reviewing this. Oops. So I'm going to get rid of what I just marked. So let's do this part, the postganglionic parasympathetic fibers to the lacrimal gland. Okay, so this is your parasympathetic pathway that you've learned. So we're going to the lacrimal gland. You know that these fibers are part of 7. So I'm just going to go back and review that on this slide, because we said that those postganglionics travel with the zygomatic nerve. Well, here we are with the zygomatic nerve. So you can't really see it, and I didn't ask you to learn it, but here come the preganglionic fibers through this pterygoid canal into the pterygopalatine ganglion. So what I'm going to draw are the postganglionic neurons. So in the pterygopalatine ganglia are the cell bodies. So I'll just make a red dot for the cell body of one of these postganglionic fibers. We're going to the lacrimal gland in the orbit, and these are the postganglionics, and they travel with the zygomatic nerve for a ways. And then do you remember where they go? They travel then with the lacrimal nerve. So we jump up here, and then we're running with the lacrimal nerve. And somewhere in here is a leader line. You may have to magnify this to the lacrimal nerve. Okay, well, that's just reviewing again that complicated piece of the parasympathetic pathway to the lacrimal gland. Okay, so that's our zygomatic nerve. Zygomatico-temporal and zygomatico-facial, two branches that merge to form it. Okay. The infraorbital nerve is this large trunk, main trunk that I've already talked about, Remember when we talked about this when we were looking at bony openings, there's an infraorbital groove on the floor of the orbit, not shown well in this slide because the infraorbital nerve is lying in it, but then it travels through this infraorbital canal, and then the nerve pops out to the infraorbital foramen and is carrying afferent fibers from this region of the face. So those are all going back in through the infraorbital foramen. Okay? So there's our infraorbital nerve. So we've done two. We've done the zygomatic nerve and we've done the infraorbital nerve. Here's another picture of the infraorbital. Infraorbital foramen, zygomatic nerve, and let's move on. Okay, then the teeth. So, sensory for all maxillary teeth. Anterior teeth, middle teeth, and posterior, essentially. So, the ASA, make sure you can spell out what those stand for. It's the anterior superior alveolar nerves. So these are all superior alveolar. There's an anterior, middle, and posterior. And within the blue box indicates that there are tiny little holes in the maxillary tuberosity, which are where the afferent fibers exit through those tiny little foramina. I put some red leader lines to those. So those are carrying sensory information from the posterior teeth. There's overlap, of course, but they're then traveling out, and they form the PSA nerve, which then again merges with the infraorbital nerve in the pterygopalatine ganglion. Through the maxilla, there are also nerves running from the anterior teeth, forming the anterior superior alveolar nerve, again merging with the IO nerve. The middle superior alveolar nerve is variable. And what that means is that some people have it and some people don't. All of the teeth are innervated, of course, but not everybody has an MSA nerve. Probably doesn't matter that much. In practice, you just know that all of the teeth are innervated one way or the other. And the fibers are either carried through the ASA and the PSA only, or if there's an MSA, that will carry some from the middle teeth. But again, they all merge back with the infraorbital. Okay? So let's move on. So the greater and lesser palatine nerves. Let's read the bullets first. Sensory for the posterior palate and the lingual gingiva. And there's a greater, or sometimes referred to as an anterior palatine nerve, which merges anteriorly with the nasopalatine. No synapse. So what that means is that if you watch note, the greater and lesser palatine nerves, there are several of them, and they run through this palatine canal, which has been carved away, and then there are several foramina in the roof of the mouth, and you remember those, the greater and lesser palatine foramen. And the nerves, what I'm pointing out here is that there's no synapse. It looks like the greater palatine merges with the nasopalatine. So if you look at it, it's just a continuous yellow line that I'll draw in green. So it goes through the greater palatine foramen, runs out onto the roof of the mouth. Just a yellow line continues on, and now we're in with the nasopalatine. So they merge, but there is no synapse. So the idea here is pretty straightforward. It's not complicated. Here comes the nasopalatine coming through the incisive canal, and it just runs out and supplies the soft palate. And then you have the greater palatine nerves. So this was the nasopalatine nerve, and the greater palatine nerve comes down, enters or exits through the greater palatine foramen, and then it just runs out and also innervates the soft tissue of the hard palate. So anatomically, if you just look at it, you would just see that it's one continuous, it looks like one continuous nerve. Those are the yellow lines. But they're made up of individual neurons. So the red ones follow the red path, the green ones follow the green path. It's like two wires going in opposite direction, but they're bundled in the same sheath. That's all. So both palatine nerves pass to pterygopalatine ganglion without synapse. So here we are, the greater and lesser palatine nerves coming up through the palatine canal, and they enter and run straight through the pterygopalatine ganglion without synapsing. And they go right into the infraorbital. Okay? So back to the synapse. Remember that all sensory pathways are one neuron pathways, and the cell bodies for all of these sensory neurons are in the trigeminal ganglion. Okay. Moving on. Basically, more of same, just a different picture. Here is the nasopalatine nerve again through the incisive canal, and the greater palatine nerve coming through the greater palatine foramen. And this is what I was just talking about. It looks like one big anastomosis. Anatomically it is, but the neurons are separate. The action potentials aren't running in a circle going both directions. They're going one direction only. Okay, the nasopalatine nerve. Sensory for anterior hard palate. Enters the nasal cavity through the incisive canal. Exits the nasal cavity, entering the pterygopalatine fossa through the sphenopalatine foramen, which is what I drew a little dashed circle nearby. So there is the nasopalatine nerve running along the bony nasal septum, and will ultimately branch off laterally through the sphenopalatine foramen, and will then merge with the IO nerve again. So this is just another picture of the hard palate showing the different nerves. Two different figures. The one on the right shows a picture of an actual skull, and then somebody drew in the nasopalatine nerves and the greater palatine nerves. And there is overlap. So if you are anesthetizing the area, you may be targeting both the incisive canal and greater palatine foramen, but I will leave that to another class for you. And then an overview. We've seen this slide before, and I put a little blue box that you should know everything in this slide. We've talked about it all. So it would be a good slide, good summary overview for different nerves. And read the blue box again, reminding you of what nerves actually are synapsing in the pterygopalatine ganglion. It's between two nerves, so we have a two-neuron pathway. Okay, and this slide is, you've seen this before. We saw this when we were studying the bones of the skull. A couple of things to note. There is the sphenopalatine foramen, through which the nasopalatine nerve travels. Also shows the incisive canal. And it's a good slide to just ponder, perhaps. And that was it. So we have done those branches of the maxillary branch of the trigeminal nerve. So again, I encourage you strongly to read the chapter in the book, skim quickly those parts that don't pertain to what we've talked about in the lecture. Pay attention to nerve pathways, because I will be assigning homework asking you to trace different pathways. So for example, I might ask you to trace a sensory pathway from the skin right over the zygoma, right over the cheekbone. So you'd have to figure out, well, what nerve or nerve branch is carrying sensory information from that part of the skin. Or maybe I might say trace the sensory pathway from a tooth. So I'll give you good directions on how to do that shortly, but right now work on these branches of the maxillary branch of the trigeminal. Next lecture will be the mandibular branch, and that one has some tricky parts in it also, but we'll do that next. Okay, see you soon. Bye.